Hi, Sycamore. It's Julie Farron. I'm the district nurse coordinator, and I'm also the licensed school nurse at Sims Elementary. Your school nurses have put together a series of videos on healthy back to school safety tips that you will review today. After you watch the video, you will do a follow-up session during a staff meeting with the nurses to answer any of the questions and go through scenarios. I am confident if we can strictly adhere to these guidelines, we can come back to school in a safe manner. So let's get started. You should have watched the Safe Schools video about coronavirus before watching our video. It details the signs and symptoms of COVID-19 and transmission. Just to recap, symptoms of COVID-19 can range from mild to severe. It can be different for everyone. Symptoms can appear 2 to 14 days after you are exposed, but you can also be asymptomatic. Sycamore put together a COVID-19 decision tree. I'm going to open it up. This is adapted from Hamilton County Health Department guidelines for schools. I am going to do a quick overview of the decision tree for you. And again, the nurses in your buildings will walk you through scenarios on the follow-up session using this decision tree. I am the district's point of contact for the Hamilton County Health Department. At the top of the tree, you can see 4 types of cases. A suspected case is someone ill but has no known exposure to anyone probable or confirmed with COVID. When a student or staff member becomes ill during the school day and presents to the nurse, we will determine if there has been any known exposure. If there has not been, then we will follow our existing illness guidelines. You know those: fever, vomit, diarrhea free for 24 hours without medication before coming back. In the next column, you will see a probable case. This is a student or staff member that is ill with the following symptoms in either category 1 or category 2 and has a known exposure to another probable or confirmed case. The nurses in each building will contact me, and I will work with the health department's outbreak response team member at that point to determine if this is a confirmed probable case. Probable cases are determined by the health department. That person would then be sent home to isolate for 10 days from symptom onset, return to school only when they have obtained a release letter from the health department determining it is safe to do so. It is important to note that the district will notify family and staff members that had any close contact with a student or staff member that was a probable case. We will work with the health department on contact tracing and following up with those cases. In the next column, you'll see that in the decision tree that we have a laboratory confirmed case in Sycamore, and then the guidance on if they're symptomatic or asymptomatic. And they also require a release letter from the Hamilton County Health Department to return to school. The last column is a definition of a close contact. You are considered a close contact if you have been 6 feet from a probable or confirmed case of COVID for 15 minutes or more cumulatively in a 48-hour period, with or without a mask. The health department treats probable causes as if they are positive until proven otherwise. If you are a staff member, because you are considered an essential employee, if you are not symptomatic, but you are considered a close contact, you are allowed to continue to come to work because you're essential. But when you go home, you must quarantine for 14 days after that exposure. You will also be asked to, you will not be able to come back off of quarantine until you have that release letter from the health department. Administration will work closely with the health department to assess risk of transmission and determine classroom or school closure if necessary. So, great news, you have a school nurse in every building. And we are invested in keeping everyone safe and healthy. You are going to receive the master slide to all our Google Slides, so you can click on any of these links and look at them closer. I am going to open up now how to send a student to the nurse. Okay. We have created an electronic nurse pass for each nurse to share with their staff. We are not doing paper passes to minimize the contact with a student. You will fill this out whenever you're sending a student to us that's not going to be routine, such as a medication or a treatment that normally come to us during the day. So anybody out of routine would have a Google form filled out. And then if it is an emergency, such as someone is short of breath or bleeding or vomiting, if you could just give us a call to let us know that that student is on their way so that we can be prepared with the appropriate PPE upon their arrival. Our district has decided to do mass temperature screenings of students when they arrive at school. If any student is 99.6 or over, they will be directed to the nurse for a recheck temperature and further evaluation if they need to go home based on their assessment from the nurse. In order to prevent potential exposure to infectious diseases in the clinic setting, the following common incidences should be handled in the classroom. I'm not going to read each one, but please review this so that you know how to handle specific issues like stomach aches and paper cuts in the classroom. The clinics are considered high risk, and minimizing the amount of time a student is down in the clinic will be very important. Each nurse has a designated isolation area for students who become ill during the day, and we are encouraging families to pick up their students within 30 minutes or less. Lastly, I wanted to pass on some quick tips that I gathered from my colleagues in hospitals and other nurses that I work with. First, assume everyone is COVID positive until proven otherwise. It's important to wash your hands frequently and not touch your mask constantly. I am a face toucher and I know how hard it is, but to assume the outside of your mask is contaminated. Stay your distance. Try to make sure that you are 6 feet or more away from other people. That's not just students, but other staff members too. Wear comfortable clothing and shoes that can easily be washed. This is not the year to wear dry clean only clothing. And then come up with a plan that you have to make sure that your loved ones at home are staying safe. Other nurses in the hospitals have said that they take they have a box in their trunk. And this is what I plan to do, is put my shoes from work in that box in the trunk. I have a towel that I'm going to put on my car seat so that when I sit on it, I'm not having my clothes from work in my car. And then when I get home, I'm putting everything in the wash and I'm taking a shower after work as opposed to before work. So I hope you found this information helpful. Remember, you can ask your building nurse any follow-up questions that you have in the follow-up session. Thank you.
Hello, Sycamore staff. I'm Jennifer Ferris, the school nurse at the high school. In this section, you'll learn more about daily health monitoring and the COVID-19 checklist. Symptom screening performed at home is important because you may have an active infectious illness that could impair your ability to attend work, or you may be at risk of transmitting an infectious illness to family, to students, to your colleagues. It's important to keep in mind that symptom screening alone cannot determine if you have COVID-19. So please seek care from a medical provider and obtain a COVID-19 viral test to determine if you're positive for COVID-19. How do you use a COVID-19 checklist? Staff will be provided with a link to download and print a copy of the COVID checklist, shown here. This checklist should be completed before coming to work or any work-related activity. And I do say work because some of our staff do not actually work in a school building, So either to your work site or your school building site or school activity. The first item on the list is to take your temperature. There are many different types of thermometers. We all realize this, but we're going to focus on oral and digital thermometers. Now, adults should wash their hands thoroughly and then use the thermometer as directed by product instructions. It's important to note that digital thermometers should only be used at room temperature, and they should only be used on clean, dry skin. The oral thermometer should be used 20 minutes if liquids that are hot or cold are consumed, because it can falsely affect the reading of the thermometer. Also keep in mind, fever-reducing medication can provide a falsely low temperature result. So we ask you to record the temperature 24 hours after fever-reducing medication has been taken. The thermometer should be cleaned thoroughly after use, followed by hand washing. So after you take your temperature, you're going to go through the rest of the list, basically going through each of the symptoms and indicating yes or no. Staff should only respond yes to symptoms that are of new onset and cannot be explained by a known medical condition. And examples might include asthma, allergies, migraine headaches, things like that. If new symptoms are present, please do not come to work. Follow your district policy by documenting your absence in frontline and any other building policies for documenting absence. It's also strongly suggested that you contact your healthcare provider for further advice. And then finally, if you have any other questions or concerns, please seek out your building nurse. They will be glad to answer any questions you may have. Thank you.
Hello, my name is Diana Wyrick, and I'm the licensed school nurse at Blue Ash Elementary School at the Sycamore Community Schools District. And today my topic is hand hygiene. There are two methods for hand hygiene. One is hand washing, soap and water, best method. The alternative method, when water is not available, is the alcohol-based hand sanitizing method. Below you'll see a link from the CDC that explains reasons why you want to wash your hands. But the basic principle is that when we touch our eyes, nose, and face and mouth, we're spreading bacteria, viruses, germs into our body. And when we touch other things and then other people come in and touch and our hands have been dirty, then they can also be exposed to those germs, bacteria, and viruses. So hand washing is your best technique to keep your hands clean so you don't get sick and other people don't get sick. So let's talk about that technique and make sure we're doing it properly so we can get the best bang for those 20 seconds. So the steps for hand washing is to rinse your hands, put a little soap on your palm of your hand and rub it in together for at least 20 seconds. Rinse with lots of water. And then you want to dry your hands well and paying attention to turn off the faucet with a paper towel. This is I have a demo for you to watch that gives you the technique though, because that 20 seconds that you're spending rubbing your hands should be to cover every part of your hand. So this method is pretty quick. And I used paint as a pretend soap so you can see where the soap and the technique is putting the soap. So rinse your hands first. And you put a little bit of the paint soap on your palm of your hand, rubbing it together. So you want to make sure you get the front and the back of the hands and lacing in between your fingers to get in between those areas. Then roll your fingertips so that gets your tips and your fingernails, and then your thumbs, and then finally your wrists. And you'll see that technique, again, 20 seconds, and you can get your whole hand covered. That's equivalent of singing the happy birthday song 2 times, but it could be any song, but for 20 seconds. Rinse your hands again and dry your hands well. Turn off the faucet with the paper towel. So that's what I want you to do and practice it well. And then if we don't have the running water, then we're going to use the alcohol-based hand sanitizer. And so with this, you want to make sure that you're using the correct amount. Check the label to make sure that you're using the correct amount. You use the same technique that you use with the the hand washing method. But the one thing I want you to remember with the hand sanitizer is that the hand sanitizer you're using is at least 60% alcohol-based, and that when you're rubbing it in, at least 20 seconds, correct, but make sure that it's completely dry. It may take a little longer than 20 seconds when you're using hand sanitizer. There's also some links below from the FDA as well as the CDC for some more information about alcohol-based hand sanitizer and the best method for cleaning your hands. So practice it and practice it often, and you'll be doing that quite often throughout your school day. So one thing I'm going to make sure you understand on this slide is this is hand washing, not using hand sanitizer, but hand washing. So whenever your hands are visibly soiled, upon entering the building, when returning to the classroom, before eating or handling food, after using the restroom, after you sneeze, cough, or blow your nose, after touching potentially contaminated surfaces, before or after touching your face, after cleaning and disinfecting surfaces, and before applying personal protective equipment, and then after removing personal protective equipment. This is when you need to be washing your hands throughout your day, and then other times as well as they come up. Again, thank you for practicing good hand hygiene to keep our school and world community safe and healthy. Please contact your building school nurse for any further questions or information. She'll be glad to help. Thank you and have a great school year.
Hi, my name is Lori Dobrowolski, and I'm the licensed school nurse at E.H. Green Intermediate School, and I'm here today to talk to you about masks. Why we need to wear masks? The picture's pretty obvious. COVID-19 spreads from person to person via droplets from an infected person through coughing, sneezing, or even talking. These droplets can be inhaled from in your mouth or nose from an infected person, and you can contract the coronavirus. People can spread an infection even though they do not have symptoms. A simple mask, will create a barrier that will keep these droplets away from you and others. Let's talk about masks. Wearing a mask helps protect you and others and those around you. We can model this behavior for our students as well as our staff. New information is emerging every day regarding the best fabric for protection or filtration, but the CDC recommends multiple layers of cotton. The best mask is a clean, well-fitted mask. They can be bought at a store or homemade, as long as it's clean and well-fitted. Who should and shouldn't wear a mask? Everyone should wear a mask. Unless you are under the age of 2, have trouble breathing, or are incapacitated and have difficulty removing your own face covering. How often should I wash my mask? You should wash your mask every day, or if it becomes soiled. That's why we tell the students to keep an additional mask in their backpack. When should I wear my mask? You should wear your mask all the time that you're out in public, when social distancing is difficult and you are not around people in your immediate family. So like around your house, you don't have to, but when you're out at a park, if it's a crowded park, you should wear your mask. Can I just wear a face shield? People ask. As of 8/15, the CDC's statement was that they do not recommend face shields as a substitute for a cloth mask. The level of protection of a face shield is unknown at this time. Does the school have a face covering policy? Yes, it does. Please refer to the Healthy Back to School 2020 for more information, and we'll work hard to keep that updated with new information from the CDC. A key point I really want to make here is, I think it's huge. We need to encourage adults in our school and in our community to wear their masks, but we don't need to judge people for not wearing them. We don't know their business. No shaming or judging. How to wear your mask correctly. You wash your hands first and foremost before putting on your mask. Put it over your nose and your mouth and secure it under your chin. Try to fit it snugly against the sides of the face so there's no gapping. If you have to mess with your mask throughout the course of the day, perhaps it's not the right size or just not the right fit. Maybe it needs to be tightened. Make sure you can breathe easily and wash your hands after taking off your mask. That is huge. Do not try to touch your mask throughout the course of the day. If you do, it's considered dirty. Wash your hands immediately or use sanitizer. What to do? How to take off your mask. Untie the strings behind your ears or your head and stretch the loops so that they come off your ears. Handle only by those ties. Fold it in half, corner to corner, sandwiching this piece in the part where your mouth touches in the middle. Place your mask on a clean paper towel next to your tray, say at lunchtime, in your fanny pack if you're going out to recess, or in a designated container, or even on your lanyard. But try to make sure you keep the part that touches your mouth together so you don't contaminate it. Be careful not to touch your eyes, nose, or mouth when removing, and wash your hands immediately after removing your mask. Wear a mask to protect your friends, and for young adults, there's a video from the CDC on here with a link. Feel free to take a look at that. Some key points I need you to know is to keep masks clean. Try not to drop them on the floor. They should always be on your face, your lanyard, or in your fanny pack. Wash them every day and keep a spare mask with you. This one didn't come across as nice, but I want you guys all to look back on this time and remember that you did all that you could to help decrease the spread of the coronavirus. This is something very small that we can do. I know it's uncomfortable, but after a couple days, you don't even notice it anymore. Get something that fits you good and that you're comfortable with. We can do this. Please refer to the CDC for any other information on masks or check with your school nurse. Thank you.
Hello, my name is Amy Bonham, and I am the licensed school nurse at the junior high. I'm here to present personal protective equipment, often referred to as PPE, used to protect people from hazardous materials. The PPE you see on people may differ depending on their role in the building. If you have questions about what PPE you will need, please contact the building school nurse. There are many different types of PPE. For the purpose to protect the school community against COVID-19, you may see the following: goggles and glasses. The purpose is to protect the eyes from exposure to airborne microorganisms. Glasses are helpful but not totally effective due to exposure from air around the opening of your glasses. Goggles are tight-fitting and offer the most protection without having difficulty with fogging while wearing a mask. Goggles are available in many different sizes and shapes. If you choose to wear goggles over your eyeglasses, you will need to keep in mind that a larger goggle is needed, something similar to what you would use in a science lab to go over your eyeglasses. Face shield. The purpose is to protect your eyes and keep you from touching your face. A face shield doesn't hold droplets from the nose or mouth. Therefore, droplets may be released into the air without knowledge from an infected individual. A mask must be worn with the face shield if closer than 6 feet to another individual. It is best practice to disinfect anything that is frequently used and exposed to germs. While it's important to wear PPE to protect ourselves and others, we need to be aware that we may unknowingly spread microorganisms, and that brings us to the next slide, which is cross-contamination. The definition of cross-contamination is the process of any microorganism or pathogen unintentionally transferred from one substance or object to another with harmful effect. Examples of these are touching your hand, whether it's gloved or not gloved, to your face, and then touching something that is supposed to be clean, like a G-tube, a cup, or a mask. Another example is touching money with a gloved or an ungloved hand, and then handing someone a piece of bread. Cross-contamination could potentially spread a virus, a bacteria, or allergen. Avoid cross-contamination by being mindful as you put on and take off your mask, gloves, or gown. There are times that people have a false sense of security that when a person is wearing gloves, that they are not spreading germs or that they're protected against germs. So it's really important that the person wearing gloves remembers not to cross-contaminate while the gloves are on his or her hands. The use of gloves, we're going to use them when we are caring for a student or when someone who potentially could be ill. We will use disposable gloves, and they must be used if you are coming into contact with blood, saliva, urine, or any other body fluid. We're also going to use them when we're cleaning and disinfecting. The CDC recommends that you peel the glove away from your body, pulling it inside out. Hold the glove you just removed into your gloved hand. Peel off the second glove by putting your fingers at the top of the glove at the wrist. Pull off away from your body, keeping the first glove inside. Dispose of the gloves in trash and wash your hands thoroughly. When do we need to wear a disposable gown? Not everybody will be wearing a disposable gown, but they will be available for those employees who are most at risk for exposure to body fluids such as saliva, urine, etc. Examples of when an employee would wear a gown are situations like cleaning a fluid off the ground or any time an employee feels their clothes may become contaminated. I have 2 videos that I would like to share, and these videos show don and doff a glove, which is taking on, taking off a glove. I'm going to play for you that video now.
Hi, my name is Christopher Harris. I'm an infection prevention specialist at UT Physicians. Joining me today is Jeff Lindsay. He is a nurse with UT Physicians, and we're going to be showing you how to don and doff, or put on and take off, gloves. Take it away, Jeff.
Before donning gloves, always perform hand hygiene. If you have any questions about hand hygiene, please see the related video. Take a pair of gloves from the glove container. Make sure to select the correct glove size. Place fingers into the first glove and pull the glove onto that hand. With the non-gloved hand, place fingers into second glove and pull the glove onto that hand. If you notice any rips or tears in the glove, then replace the glove. And remember that if you're wearing a gown, the gloves go on top of the gown. And for doffing gloves, the outside of the gloves are contaminated. Using a gloved hand, grasp the palm area of the other gloved hand and remove the first glove. Hold the removed glove in the gloved hand. Slide fingers of ungloved hand under the remaining glove at the wrist and peel off second glove. Discard the gloves. Remember that gloves do not replace hand hygiene. You must perform hand hygiene when taking off gloves.
The second video is putting on and taking off your gown, and it also has the gloves in it as well.
Going to begin skill number 8. This is donning and removing PPE, gown, and gloves. This is done at a station, so you will not have a patient to greet and identify. So all you do is you pick up your gown and you put it on with the opening facing the back. You're going to slip your arms in. You're going to tie your gown at the neck. You're going to cover your back as much as possible. You're going to tie your gown at the waist. Always tie your gown in the back at the waist, never in the front. Then you're going to apply your gloves. Your gloves go over the cuff of your gown, as you see here. Gloves go over the cuff of your gown. Now I've finished putting on my PPE. So now the critical step on this skill is how you remove the PPE. So I'm going to remove my gloves first, grabbing the first glove at the palm, remove the glove, turning it inside out as you remove it. Slip 2 fingers, 1 or 2 fingers under the cuff of the second glove, turn it inside out as you remove it. Those go into your biohazardous waste container. Untie the gown at the waist and neck. And the important part of this is that you do not touch the front of your gown at any time with your ungloved hands. Reach inside the shoulder area of the gown, turning it inside out as you remove it. You're only touching the inside of the gown as you remove it. You're rolling it dirty side inward, not allowing it to touch the floor, and you insert it into the biohazardous container and wash your hands. And that's the end of skill number 8.
When taking off the disposable gown, make sure that none of the gown that's contaminated touches your clothing. That's the whole purpose of wearing the disposable gown. And make sure that your gloves don't touch anything. Make sure you thoroughly wash your hands before you put on any PPE, and make sure you thoroughly wash your hands after you take off the PPE. Thank you.
Hi, this is Carolyn Nady. I'm the school nurse from Mapledale Elementary, and I'm charged with introducing you to physical social distancing portion of the training. I'm going to start off with a video. Actually, it's a song about social distancing.
Social distance rules say go 6 feet that way. You know I love you, but I just can't touch you. We can hug again, maybe someday, but go 6 feet that way. Tell me why not we can stop the spreading. Tell me why health care is taxed already. That is why we all should be okay to go 6 feet that way.
So, what's Sycamore's plan to maximize physical distancing? Well, students will be kept at least 3 to 6 feet from each other. Adults will be kept at no less than 6 feet from others. That's a recommendation. Desk spacing will be maximized to the best of the classroom situation, but at least 3 feet apart. Students will remain seated at their desk, and there'll be no sharing of common supplies. What is the purpose of social distancing? Well, it's to help prevent the spread of COVID-19. The CDC, the Ohio Department of Health, and Hamilton County Public Health recommend that all students and staff practice social distancing. Social distancing or physical distancing means at least 6 feet between oneself and other people who are not from one's household. What 6 feet look like? Well, you might think of a bicycle length, 2 big dogs standing in front of each other, 2 shopping carts, whatever reference you want to think about 6 feet. You're just going to have to be mindful of your distance from yourself and the person or the child next to you. I'm going to end social distancing by a little video explained by kids. And I want to let you know the update 6 feet is advised, not 3 feet. That is in this current video.
Social distancing. It's a word you've probably heard 100 times over the past few days. But what is it? And is it important? Should we abide by it? The answer is yes.
Social distancing is the idea of minimizing the contact we have with other people so we can help reduce the spread of a virus, like the coronavirus COVID-19. The intent behind social distancing is to slow the rate of the epidemic, or as you may have heard, to flatten the curve. This will help the healthcare system from getting a massive influx of patients all at once and overcrowding our hospitals.
By social distancing, we'll help reduce the rate of spread over time, which will allow us to get control of the virus before it takes over at a rate we can't handle.
Hello, Sycamore. This is Susan Linton, licensed school nurse with Sycamore Community Schools. I'm going to present the Med Administration training for Sycamore Community School personnel, which is given on a yearly basis for school staff personnel before they go on field trips to give medications that may be needed to students. The law for school administration of meds was updated, Ohio Revised Code 3313.713, which required school employees to administer medications to either be a licensed health professional or complete a drug administration training program. And this was enacted in 2011. So you have been given this training every year since. So this is now online. Hope it will be easier for you to do. And then we will give you the med quiz in person. Also note that substitute teachers, not district employees, therefore do not meet the board policy criteria for administration of meds. So they will not be able to help with any med administration on any field trip. So you can see here, these are the course objectives for the program. Identify the requirements of Ohio Revised Code 3313.713. Explain how federal confidentiality law, FERPA, and HIPAA affect medication administration. Locate the local school district medication administration policy. List the components of the local school district medication administration policy. Tell the general procedures for administering medications in the school, including the 6 rights of medication administration. Successfully demonstrate selected medication administration procedures. Medication administration in schools is guided by federal laws, FERPA, Family Educational Rights and Privacy Act, which ensures confidentiality of student records, and records must not be disclosed to anyone without consent, and also HIPAA, which is the Health Insurance Portability Accountability Act. Generally, this does not apply to schools. It does apply to healthcare providers with whom schools may work, which would be the nurses. If confidentiality is breached, it can lead to liability and lawsuit. So this is very important to maintain student confidentiality. Field trips. A field trip is an extension of the normal school day. Therefore, we need help in regards to medications that need to be given on the field trip. And this is usually where the staff become an important role in regards to helping students receive their medications. The same medication policy and procedures apply on field trips as during the regular school day. School policies and procedures regarding medication administration also apply to school-sponsored extracurricular activities. So school personnel administering medication, over-the-counter medications must also be trained. Please consult with your school nurse regarding medication and forms and receive the training.
Medications that can be administered are the prescription and over-the-counter medications. Sycamore medication policy applies to both meds, and we do need these medications brought to school in their original container. Medication order form, as you see here, is needed in order for us to implement any medication order. It must be signed by the prescriber and the parent, which is on the form here. If you take a look at it, you can also click down the bottom to look at a clear blank form. The form is located under the Health Services tab on the district website. So if you have any questions from parents, you can direct them to that on our website or call us, let us know. A new medication order form is required each school year. Parents are required to tell the school nurse about any changes in medications administered at school. Each medication change will require a new medication order form completed by the prescriber and a new pharmacy label bottle to match that order. The 6 rights of medication is the standard safety procedure followed by all people who administer medications. This is very important to know and to follow each time you administer medications. How do you remember the 6 rights? I must do this right and document. So the acronym here, as you see, stands for the right individual, the right medication, the right dose, the right time, the right route, and the right documentation. These are very important to remember. 6 rights of med administration. Include these each and every time before you give any medicine to students. So check the right student. You can ask the student to state their name. You can ask another staff person to identify the student and also refer to a photograph if possible. Compare the student's name on the medication order with the student's name on the medication label. If both names do not match, do not give the medication. Contact the school nurse for instructions. Right medication. Check that the name of their medication matches on the medication order form and on the medication container label. If medication names do not match, do not give the medication. Contact the school nurse for instructions. The right dose. Check the exact dose of the medication on the medication order form and also on the medication container label. If the medication doses do not match, do not give the medication. Contact the school nurse for instructions. Right time. Compare the exact time in both places, the medication order to that on the medication container label. If the times do not match, do not give the medication. Consult with your school nurse. Medication given within a half hour before or after the order time is considered on time. So we have a half hour before to a half hour after the order time on that order to be considered on time. The right route. Compare the medication route in both places on the medication order form and also on the medication container label. If the routes do not match, do not give the medication. Contact the school nurse for instructions. Right documentation. While documenting medication administration, compare the medication container label to the medication order and then document on the med log as you see here in the background. As stated, never get a medication if the written information in the prescribed order does not match the container label. Always ensure confidentiality. Explain the procedure to the student and position the student appropriately for medication administration. So if you're on a field trip, it's best to take them aside to a quiet area, free of distractions in order to give the medication safely and check your 6 rights. School personnel should always observe the student taking the medication to be sure they swallow it, and always observe the student for any unusual behaviors or conditions before and after medication administration. Report any unusual behaviors to the school nurse. Medication incident reporting form, as you see here, for any medication error that may occur, you need to fill out this form and we will review it So any medication incident would include an omitted dose, incorrect time of administration, incorrect student, improper injection technique, or incorrect route of administration. The school nurse and administrator will review the medication incident reports to analyze any patterns and take steps to avoid or reduce future incidents. Thank you for completing the medication administration training. For more information on the Sycamore Community Schools Med Policy, you can click here. And as always, you can contact your school nurse with any questions. Thank you.